Hello, and welcome to another episode of Let's Get Plugged podcast. I am your host, LaShawn Davis. I am excited to be here tonight and chat with you all about the industry and the career of nursing. And as you all know, we have been, for the past couple of weeks or so, talking about life as a certain careers. We've talked about flight attendants, we've talked about life as a female truck driver, and tonight we're going to be talking about life as a nurse. And this topic is critically important because number one, I don't know that I recognize the bravery and the courage that nurses, at least in this country, face every day with what they're doing and what they've been doing since the onset of the pandemic. How, they've risked their lives to save other lives through shortages of PPE and protective gear and lack of mask, and just the things that they've done. I just definitely wanted to acknowledge that tonight and give them some public recognition because it's definitely a thankless job. A lot of people, think about doctors being the primary, profession to take care of patients and do all of those things, but it's really, the nurses that tend to truly care for in and out these patients, and the doctor kind of oversees it from a medical standpoint because of them having the licensings and things like that. And so, definitely the medical industry has been under a lot of extreme pressure. And we've talked about on this show the extreme pressures and the burnouts and the frustrations and the demand that has been weighing on HR professionals in the workplace. But tonight we're going to focus on the amount of pressure that's happening in the medical industry right now. So if you're watching, just make sure to say hello in the chat. Let us know that you're watching. Let us know where you're watching from. And let us know if you're a nurse, if we have any nurses out there, because I definitely wanted to give you some recognition for the work that you do. Also, if you have any questions or if you have an interest in being a nurse, this is your opportunity to ask it because our guest tonight is a nurse, and she's actually a nurse practitioner, and she's been in the nursing industry for the last 15 years. So she's definitely a subject matter expert in this area. And she's going to tell us a little bit about what's happening in this industry. She's going to share her experience in this industry. Would she change it? Does she love it? Does she hate it? There are massive amounts of nurses that are exiting the nursing industry. A lot of it is because they've been overworked. A lot of it has been because of what's happened with the pandemic. A lot of it, as I understand, is actually pre-pandemic. There has been a shortage of nurses, but the pandemic has really, expedited this timeline of people exiting quicker than people are entering the field of nursing. So we're going to talk about that tonight. And I see Victor online. Victor's my husband, y'all. Thank you for joining your favorite day of the week because it's my podcast show. So if you're here, definitely let us know. Say hello. Throughout the show, we will stop. We will address your comments. We will answer any questions that you have. Because as I always state, this is for you. This is a platform for you all, especially if you have an interest in the nursing field. Definitely take the time to ask any questions that you have so that we can make sure that you get what you need, because I know that there's definitely an urgency in this field. This field is in a state of emergency. And I want to do what we can to just shed some light on this career route and, also dispel some myths and rumors that are out there. So tonight we're going to talk about life as a nurse, but we're also going to talk about COVID, because a lot of people believe that the COVID pandemic is dying down as more people are getting vaccinated. And then some people are still not getting vaccinated. And so there's no risk because of the herd that have been vaccinated. But we're going to have some conversation about that tonight and really and truly understand, are we out of the waters when it comes to COVID? Can we kind of breathe a little bit here? Or is it still something that we should be concerned about? Should we get the booster shots? Like what is going on? And so we're going to talk about that a little bit too. So if you have questions, concerning that, remembering, we ain't giving no medical advice. This is just some things that you can, if you have a question or you want some guidance on something that you may have heard or read and you're just not certain if it's true because it doesn't sound right, this is a platform that you can ask. And if we don't know, trust me, we won't answer it. So it's just definitely a resource that you can definitely, that you'll want to take advantage of. So Again, if you are watching, thank you for watching. And be sure to subscribe to this channel. You can subscribe, hit it right there on the YouTube button, hit subscribe. If you're listening to us on the audio platform, thank you for listening. We are on all the streaming applications that you might listen to your favorite podcast on. You might be able to catch us there as well. You can definitely connect with me on all of social media at the HR Plug or visit our website, www.thehrplug.com. Our website has just been revamped, so make sure you check that out. And definitely, kudos to Perfect Zone Productions because they did a fantastic job with upgrading our website so that we can make sure that we're meeting your needs as you need us to do with our company. So, thank you guys for joining. Thank you guys for tuning in. I see a lot of you out there. But we're going to go ahead and get started. And I'm going to jump in and invite our guest, Nadia, out to the platform. And so here is Nadia. Hi, Nadia. How are you tonight?
Hi, how are you?
Good. Thank you so much for being here on the show.
Thank you for having me. I'm excited to talk about the wonderful world of nursing.
Listen, I learned a lot just from talking to you, over the course of the past few weeks because, full transparency, we were supposed to have this conversation a while ago, and
Yep,
you got sick.
I got COVID.
You got COVID, and so it got postponed a little bit.
Yes,
So
yep.
you're letting us know COVID is still alive and well.
It's still here. It's not going anywhere anytime soon. So we can have a good summer, I think, but to still take precautions because we don't want to be like suffer the consequences in the fall.
Yes, yes, because
Yep.
in the fall, like with flu season, it kind of
Yep,
complicates
and
it.
school starts back, and then you have more people, and more people equals more spread. So you want to take precautions now, vaccinated, boosted, all those things, so that we can avoid that.
Well, we're definitely going to talk about that because a
Yeah.
lot of people think we're out of the water, but look who's watching. Hi, Miss Hankerson. Thank you
Oh,
for
hey,
joining. Look,
Mama.
thank you for joining us and watching and tuning in tonight. So we're excited, Nadia, to talk about this. But before we talk about COVID and before we go into all of those things, let's talk about the bravery. First, thank you for the sacrifice you make. I mean, I see nursing honestly as front lines. Like you're putting yourself out there in unfamiliar, unknown territory with the COVID. We still don't know a lot about that.
Right.
And the medical professionals are still working on that. But even outside of COVID, just what you all do at the varying levels of nursing that exist.
Right.
Thank you, for what you do. So I definitely want to appreciate you there.
Thank you. It's
Yeah.
definitely a calling. Yeah.
Like teaching, right? It's one of those things.
Yes.
It's not for everybody.
Mm-mm.
Um, so tell us a little bit about you. Like, what's your nursing journey and what got you interested in this field?
I've always just been a caretaker, but my nursing journey started about 15 years ago. I went to nursing school in Miami, Miami-Dade College. Shout out to Miss Gibson, best clinical instructor. Um, and I ended up moving to Atlanta and started working in cardiology, and I haven't looked back. So I started off as a registered nurse working cardiology, ended up getting my master's. Now I work as a nurse practitioner, so I took it up a little notch. So I'm able to work in a different realm, but still nursing. I'm always a nurse first.
Wow.
Yeah.
So there's different realms of nursing, right? So
Yes.
walk me through the different. I know there's probably hundreds of different types of nurses, but I guess the different
Yes.
levels of
There's
nursing
different
that
degrees.
exist. Different degrees of
Yeah.
nursing. Okay.
Yep. So you can start out as an LPN, which is a licensed practical nurse. You do have to be board certified for that. But that nurse can do most things, but they have some restrictions as far as medications that they can give, procedures that they can perform, things like that. Then your next step up would be the registered nurse. Registered nurses can have associate's degrees, 2-year degrees, or bachelor's degrees. You can also have a master's degree as a registered nurse. And then you have the full scope of what a nurse can do when you have that RN, a registered nurse degree. Now, when you want to take it a next step higher, you can get the master's degree. Then you can teach. You can have be a nurse practitioner. There's different types of nurse practitioners. You can be primary care. You can do internal medicine, cardiology, like myself. Um,
Okay.
deliver babies. Be a nurse midwife.
Wow.
Um, nurse anesthetist. It goes on and on. I mean, it's endless.
Wow. So I can hop around. Like if I'm a this kind of nurse, I can specialize or I
Yes.
can be general because you were saying your sister is also a nurse, right?
Yeah, she's an emergency room nurse. Yep.
So, so
Yep.
there's
In that, you
all
see a little bit of everything. So, yeah.
wow, wow,
Yeah.
a lot out there, and
Yes.
so there's ways to be a nurse without a degree, but there are formal educational pathways you can take that you can get a degree in nursing.
Correct. And one I forgot that I'm working on now is the doctorate in nursing. So there's a doctoral level, which is the terminal degree of the profession. So you can't go any
Hmm.
higher than that, but you would be a doctor of nursing practice.
Wow, and you
Yeah.
can have your own practice.
Yes, you can have your own practice as a nurse practitioner in the state of Florida. There's a couple of other states that also allow that independent practice where you are no longer underneath a physician. You can see your own patients, have your own building, bill for yourself, total independence.
Wow.
Yeah,
So what keeps you here in this space?
that's a good question. I think, like I said, it's a calling. I'm not here for the money. I'm here to truly care for the patients.
Mm-hmm.
It's the people that I meet, their stories. Those are the things that keep me coming back day after day, year after year.
15 years is a long time
Yes.
doing what most are describing right now as an impossible industry because of the demands and
Right.
that's on nursing. And so I've seen a lot. And listen, I'm just going off of what I've heard about like traveling nurses, like
Mhm.
nurses that what travel to different areas in need. Talk to us about what that's like.
Okay, so traveling has always been around, but right now there's a travel boom because agencies are in demand. They're very popular right now because of the nursing shortage and because of COVID. So, as a nurse, you can take contracts anywhere you want, 13-week contracts, 10-week contracts, 9 weeks, go wherever you want in the United States, and they will pay you substantially more than what a regular organization locally in your state would pay.
Mm-hmm.
So that's the attraction right now to nurses to travel.
But you got to be away
Yep.
from home basically for
You
that
have to be
time.
away from home, yeah. Or you can
Mm.
take a local contract.
Oh, okay. And where you won't have to travel because you're right there.
Correct. So I'm in Central Florida, and if I wanted to be a travel nurse, I just take a contract in Central Florida and just work at the hospital down from my house, but still get the travel rates.
So what is it? Is it that you lack benefits? Is it like you, as a travel nurse, you're more like a contractor versus an employee?
Correct. You don't get those long-term benefits that we all need, essentially.
Right. Like your
Yeah.
health care,
Correct.
those types of
Hmm.
things. Gotcha. So conceivably, if you're married and you're on your husband or your wife's medical plan,
Hmm.
then you may want to consider traveling nurse because you don't need those benefits of being a full-time employee attached to an
Yes.
organization.
Correct.
Gotcha.
Yep.
So there's a lot of options out there if you're truly interested in the nursing field, in a nursing career, because it's a calling, as Nadia said, and sometimes you just can't control what you're called to. And definitely it's a need, just like
Yes.
teachers are a need. Like it's definitely a need. So the purpose of this conversation isn't to discourage anyone from wanting to be a nurse, of course, but it's really just giving you a snapshot into what life is like as a nurse, especially today. And
Hmm.
so that just brings me to my next question, Nadia. Like
Hmm.
COVID,
Hmm.
what was it like? Because you work in a hospital, so what was it like
Yes.
at the onset of COVID?
In 2020, when COVID started, it was scary. It was you'd see, like, New York was worse than Florida. So you would see the numbers in New York, and then you would get ready for work in the morning, and you're thinking, I'm leaving the safety of my home to go and into a fire, essentially.
Hmm.
So it was anxiety producing. It it was kind of depressing at times. So it was rough for a long time because we also didn't have any documented treatments. It was new. We didn't have pathways to follow to care for the patients. It was an experiment essentially in the beginning.
Wow. And
Yeah.
and because it's a calling and because you're trying to care for patients, I read that, a lot of nurses sacrifice their own health because we
Yep.
just didn't know what we didn't know.
Right. Right. So,
Scary. And I also read that an article on MSN the other day that, the doctors and the nurses right now are on the verge of a mental health crisis because of
yes.
what they went through, or and I don't know if it's still rampant in the hospital for COVID right now.
It's it's not rampant. It's much better than it was. But what I'm seeing now is it's creeping back up. Not anywhere near where it was, of course, but the patients are coming little by little. I'm seeing the numbers creep up again. And so you think, oh no, here we go again. So it's almost like, I'm not going to compare it to PTSD, but I think eventually, once everything plays out, I think we're going to see that
Mm.
because of the mental toll that it's taken.
I remember seeing on the news New York, like the bodies that of people that were just there wasn't
Yep.
places to put them. I can't
No,
imagine walking into
no.
work and feeling like you're in a morgue, but you're really in a hospital.
Yeah. It was stressful. It was sometimes you have to make a decision. This person is 82, this person is 42. So
Mm.
there's no space. So who are you going to save? Those
Wow.
types of decisions, they weigh on you eventually.
Wow. Never thought about
Yeah.
that. Like how,
Hmm.
and it is a decision you make as a human that you have to live with whatever decision you made.
That's it. Yep.
Gotta be hard.
It
Definitely
is.
gotta
Yeah.
be hard. And how was your employer during this time? Were they pretty understanding? Because I know there was like a lot of shortages of masks and, things like that. How did you feel as far as how did your employer make you feel during this time?
If initially we were kind of grumbling, a little bit worried because we didn't have the supplies, but our facility was really swift in getting the necessary things that we needed. But for a while, I think to err on the side of caution, they were proposing that we use protective equipment that's meant for one-time use for extended periods of time, just to, hold on to the supply because we didn't know what was ahead.
So if I'm supposed to wear like a disposable mask
Hmm.
today and then I throw it away because I'm leaving and I'm going home, I
Yes.
was expected to hold on to this mask until it's falling apart and not staying on your face because we don't have enough for everybody to get a new one every day.
They gave you a brown bag and you put your mask in the bag for protection. You put it in your locker and you wear that mask the next day. Now these were the N95 masks. These
Hmm.
were the ones that you can go into the COVID rooms with that would protect you. So they're supposed to be one-time use, but we had our little brown baggies and we would use them for 7 to 10 days.
Because it was that or nothing.
Correct. And they came up with this sterilization technique to say they were sterilizing them so that they were safe to use for the extended periods of time.
Wow. And then,
Yeah.
I work in HR and I'm so accustomed to, people going on strike, because of pay, because of, not wanting to work. But the nursing industry was going on strike because of safety, like just not
Yes.
feeling safe and wanting something more to be done about it and coming
Yes.
together. It was that
Yes.
bad.
Yep. It was bad because you are asked to care for more than what is safe. But
Mm.
that's your profession. You don't want to let anybody have any harmful effects because, you're overworked, but, you had to make it work.
So you talked about the people you meet being one of the things that
Mhm.
you love about
Yes.
this industry. Do you have any regrets about anything that you've encountered as a nurse in your career?
I can't say that I do. I truly love the profession. It's been amazing to me. I have grown. I met my husband in this profession. It
He's a
has
nurse too?
been it has
Yeah.
been amazing. Yep,
Wow. You married a nurse.
I did. I did. I married the nurse who trained me as a new nurse. So,
Wow.
yeah.
Wow. So you can even find love in nursing.
Yes, you can. Who else can you relate to? I mean, you go
Right.
home and talk about your day. Nobody else knows.
That's true. Or can relate.
Yeah. Mm-hmm.
True, true. So, what advice would you give any nursing student who's watching this right now, who's like, I'm in nursing school and I think this is something that I want to do? I feel like it's my calling, but everybody else is telling me don't do it because of what they're seeing happening with this industry. What advice would you give them?
I would say focus, put your head down, grind through it. If it's your calling, it's going to happen. It's for you. It will be.
Mm-hmm.
It's something that once you get started in it, if it's not for you, you're going to find out. Time out. You're going to find out in school if it's for you or if it's not, because it's much worse when you're in school going through the clinicals than when you actually are employed, because some of the things that you're exposed to, and then you don't really have all the knowledge that's there, so it's more grueling. So they'll weed you out, in school. So if you make it to the end, it's for you.
It's for you,
Yeah.
and go for it.
Go for it. Don't give up. It is hard. It is stressful. Yes, but it is rewarding on the flip side.
So, how is the work schedule? Like, I know it's not a Monday through Friday, like,
Nope.
banker hours at all. How do you cope with work life? Your work and your life.
So most nurses do 3 12-hour shifts. So that gives you 4 days out of the week to live your life, be with family, take kids to school, pick them up, things like that, doctor's appointments. Whereas Monday through Friday schedules, you don't really get that because you don't have, where do you put your doctor's appointment? You got to take off so you can do those things.
Mm.
So nursing has that flexibility. I myself work 4 10-hour shifts. So I have some days off during the week also. So it's the work life balance, I would say, is amazing.
Because you get longer hours, which people primarily work anyway, right? Like
Right.
if you work an 8 hour, I say, job, you're usually there longer than that. And so
Right.
instead of working 56 hours a week because you're there every single day, you can kind of control when you're there working
Yep.
those hours, and then you have your free time.
Correct. Yeah.
Wow.
Yeah.
So, um so what about the night nurse? Is there any, like, how do you function as an, like, if you work the late shift?
That is good for some people. Um, you get paid more. There's a shift differential. You have your days to yourself. So if you could stay awake, you could still do everything during the day that you have planned and that regular people do during the day. But for me, it's hard on the body. Like I
Mm.
felt like a zombie. I didn't feel well. I was sick. So night shift wasn't for me. Occasionally I would do it just, you know, when I was in school, because you can study, the patients are sleeping. Um, so there was that freedom, I guess, but it was not for me.
Especially with a family, I can
More power to
imagine.
the night shift nurses.
I can imagine it's also hard with a family, right? If you're, working those hours, and then you're
Right.
sleeping in the day when other people are. But it is for some people. So
It is for some people. There are some night shift nurses that are through and through night shift. They love it. There's no complaints.
really,
Um, and they just live their life that way.
wow. And so then there's so when you first graduate. is it kind of like an initiation where you have to do, like, do you have to start there?
Like hazing.
Yes.
Yeah, so most new nurses they put you on nights.
Uh,
It's more so because the workflow is less. You have more time to learn and grasp concepts, grasp care for the patients, work on education, learning. That's really the point.
mhm.
Um, I don't think they're doing it to be, cruel or whatever, but most new nurses do end up going on night shift.
And how's the training? Like, are you partnered with a more seasoned nurse when you first start? Because I can imagine, I think what would stress me out most is like making a mistake. Because I saw on the news not too long ago, like a nurse was facing criminal charges because she gave,
Redonda. Yes.
yes, yes. So
Yeah.
you know exactly what I'm talking about. So that scared me. Like, especially if you imagine COVID and everything that's happening and stress. How is the training and before you're like kind of on your own?
So typically you'll have a preceptor, which is supposed to be a seasoned nurse, and you're paired with them usually for like 4 weeks, 3, 4 weeks, and then you take half the assignment, they take the other half, and then eventually you end up taking the full patient load.
Hmm.
Towards the end of that training. So you should get, a good feel and feel comfortable by the end, but you never feel ready. You're just gonna have
Mm.
to do it at the end. Um, but what's interesting is that we've talked about staffing shortages.
Yes.
Right now, the problem we're having is that the nurses that are training the new nurses are not seasoned because the seasoned nurses have retired.
Mm.
So then you have less competence,
You got the
right? Because you don't have that experience that's leading the
experience.
way anymore.
The blind leading the blind a little bit.
Correct. Yes.
So are they allowing for early retirement?
It's not early. The average age of the nurse is like 50.
Mm.
So the older nurses, they have left or they're leaving. So then now you're stuck with this influx of younger nurses um, that are not necessarily trained properly. With COVID, a
Mm.
lot of the seasoned nurses left and just went ahead and took their retirement.
And they said, I'm over it. I can't.
Done. Yep.
So I saw that there's this nurse crisis because they projected by the year 2030 we will have a grappling shortage
Mhm.
of nurses and not enough to do the care. What, if anything, do you know is being done about that?
So there's a lot of things that are leading to that shortage. A retirement of seasoned nurses. Also, the baby boomers are living longer, so there's more of a need for nurses.
Mm,
So you have that need, but it's not meeting the demand. Like we don't have enough. So that's kind of what we're dealing with. And I think what these organizations are doing nowadays is they're trying to incentivize nurses to come into the profession, nurses to stay with the organizations, a lot of things that really should have been going on all along. And maybe we wouldn't have had these people, this
mm-hmm.
mass exodus of nurses. Um, but they're trying.
Mm.
Yeah.
What are you most fearful of for the nursing industry in the next 10 years?
I'm afraid because of this recent case of this nurse that you just
Mm-hmm.
mentioned that this shortage is going to lead to medical errors, unfortunately, patient deaths. And now that we've seen this first case ever, a nurse charged criminally
Mm-hmm.
for a medical error.
So that's the first time that this has ever happened?
The criminal charge. Yeah, she's
Wow.
facing, I believe, 3 to 6 years in
Mm-hmm.
prison. Yeah.
So what concerns me about that is I think about, I saw a clip of the court case where she was remorseful and all of that. Like she made a mistake.
She
Unfortunately,
did.
the mistake caused the patient to die because it was a lethal dose of whatever she gave. And even the
Right.
family was like forgiving of her and, and all of this
Yes.
stuff. But they're still seeking criminal charges for her. And
Correct.
I just didn't understand. I had never heard of that.
Yeah, we're all baffled by it. I don't know if they were trying to make an example out of her or what, but it really could deter people from coming to the profession.
Because of that. I mean,
Yeah.
everybody makes mistakes in some point. So if I'm going to face criminal charges for making this mistake, I might as well just not do this industry, is
Right.
what
It's
people
scary.
think. But
Yeah.
yet, when we were talking about the unfortunate mass shooting in Buffalo, and
Mm-hmm.
I was talking about it on this episode about the 911 operator who hung
Mm-hmm.
up on the assistant manager that was in the store trying to get help, saying, "Well, call me back when you're not whispering," or whatever, and hung up.
Mm-hmm.
And
Yeah.
all that time, those people died because she wasn't doing her job to get them the help. But there's no criminal charges for her, and that was,
Correct.
willfully negligent in my,
Right.
unlawyer opinion. But
Right. Right.
and of course, I don't know all the facts surrounding the case with the nurse and all of that, but it was striking to see that, knowing what nurses are facing right now. And
Yes.
all the nurse support for her. Like, it wasn't even like nurses were mad. Like, they were supportive
No.
of
Support.
this not
I mean,
happening.
there were
Yes.
protests. There were like petitions. There were all kinds of the GoFundMe's, like everything in support of her because it can happen to any of us.
Anybody. Wow. And where was that? Do you know what state that was
It
in?
was in Tennessee.
Tennessee.
Yep.
Wow. I saw that and I was like, what? I
Yes.
just, so you guys, you can Google that if you really want to know more about it. But conceivably, and Nadia, correct me if I'm wrong, the nurse, she gave the incorrect dose. The patient passed away, and now they're seeking criminal charges against her for the death.
Something like that. She reconstituted the wrong medication, meaning she drew up the wrong medication, a medication that was supposed to be a sedative to just relax you. She ended up giving a paralytic, something that completely paralyzed the patient. So the patient ended up having cardiac arrest and unfortunately passing away. So it was, the medicine started with the same letter, so it was a quick mistake. She had a student, she was training someone, she was busy, and she hit the wrong button on the med dispenser. And unfortunately, that's how that, transpired.
It was an honest mistake that led to an unfortunate result. Definitely not minimizing that, but it just goes to show what you were just saying. You have the newer nurses trying to train other nurses because of this shortage. And
Right,
on top of that, do their job,
right.
in the middle of a crisis. I mean, it's just bravery at its finest. If bravery was a career, it definitely, would fall under nursing because there's just a lot of risk. There's just a lot of
Yes,
risk and a lot of liability now
yes.
for your
Hmm.
freedom.
Yeah, we have to have malpractice insurance. They recommend it. You don't have to have it, but it's recommended to have it so that you're covered, just like a physician, because there's like room for error. And as you see
Yeah.
with this Tennessee case, you got to protect yourself.
Yeah. Yeah. Because it prevent, like, if the family could decide to sue you personally, right?
Yep. Hmm.
And the hospital. And that's
Yep.
why I was curious about the training. But to your point, if I'm new, been in maybe 2 years as a nurse, and I got to train somebody else, it's just a lot. It's just a lot. Wow,
It's a
wow.
lot. Yeah.
And so you can be a different kind of nurses. So clinical nursing, like nursing in a hospital, right? Um is that one of the more challenging nursing roles to fill because of things like that?
I would say so. You have more responsibilities, more, you're giving more medications, you're doing more procedures, more so than, I guess I would say, a nurse that's in the office. So there's
Has,
different
ha
responsibilities.
so what is like the biggest difference between like the nurse practitioner and the doctor?
Um, for me, I'd say work-life balance. That's really the only difference that I'd say. The schooling is less. Doctors, I think, they do what, 8 years or something like that.
Mm-hmm.
Whereas we are, because we calculate it all, it's 6. So there's a
Mm.
little bit of difference. Um, I can say that the benefit of it is that nurse practitioners have been nurses first. So we typically are better people, with people. We have better bedside manner. We
Mm.
spend time with the patients because we've been doing it before as a registered nurse or an LPN prior to. So that's the good side, I think, of being a nurse practitioner. But we can see our own patients, we can prescribe medications, we do assessments, order testing, all of those things.
Wow. So it's really like the schooling and the time that you're having to spend in the practice as a doctor versus in the practice as a nurse.
Right.
Wow.
Yep.
Okay. And so let's see. I first am just blown away by all that you've shared tonight about the nursing industry and what bit of advice? So we talked about the advice you'd give to students, like a student that's a nurse right now, or someone that's considering this field or this industry.
Mhm.
What if I'm a nurse and I'm already working? I'm not a student, and
Mhm.
I'm feeling a little discouraged or demotivated. What encouragement would you provide to any nurses watching this right now that could be struggling?
I think it's important to know yourself, know when it's too much, know when you're showing signs of being burnt out, because you don't want to get to a place where you make a mistake because maybe you're struggling or just not feeling it. I think it's important to take time for yourself, use your PDO, it's there for a reason. Take those mental breaks. I'd say once every 4 months, take a couple days off,
Mm-hmm.
refocus, then come back. I think it makes you a happier person. You're able to care for the patients better that way.
Especially if it's your calling, don't give up because of a moment of
Correct.
burnout. Recognize it. And I mean, I guess what you're saying is the same thing we were saying, when we were focusing on the burnout in the HR industry. It's kind of the same
Right.
thing. So it probably goes to
It
any
is.
career. Being able to recognize when you're at capacity.
Right. Know yourself. You can feel it. Other people can see it. You might be short tempered. You might be noticing, oh, my blood pressure is up, or you just are not excited anymore. You don't have that same sense of joy. Those are signs. Just take a
Mm.
moment, step back, take a day off, take a week off, whatever's necessary.
The patient will get the care they need when you're gone.
Correct.
Mm-hmm.
Another great nurse will step up.
Yeah, because
Yep.
they're out there for sure.
Yes. Yep.
And so what's next for you? So you talked about you are pursuing your doctorate degree in nursing. What are you going to do with that? Like, what is next on your agenda?
So the program I'm in is a psychiatric nurse practitioner certification program. So it's my hope to focus on the mental health side of nursing, to treat patients that are struggling with mental health issues. I think specifically veterans I like to work with. I also want to focus on the aftermath of this pandemic that we're currently in.
Mm. Because
Yeah.
I mean, it's all in there in the news. A toll that it's taking because of the things that nurses have seen, witnessed, and doctors and others that work in the health industry, and some not. Like
Right.
just to see it, it's definitely
Yeah.
a mental health toll.
Yes.
Wow. And
Yeah.
so there are psychiatric nurses.
Yeah. Psychiatric nurse practitioners. There's also psychiatric registered nurses that work just on the psychiatric units, taking care of patients, giving medicines, that sort of
Wow.
thing.
Nurses are everywhere.
Everywhere. Yep.
Even schools have nurses. The school nurse, like.
There's school nurses. There's occupational health nurses where you're
Mm-hmm.
on site at jobs.
Mm-hmm.
So in case large corporations, if employees get injured, you go see the nurse.
There's on site.
There's so many things.
Mm-hmm. So don't let what's happening in a hospital setting deter you from pursuing this career, if this is a career path that you're truly passionate about or have a calling for, as Nadia put it, because it's a plethora of options out there.
Yeah,
That,
the choices are unlimited, and there's always going to be a need. With COVID, if you see a lot of industries were shutting down, we were ramping up. It's
yes.
never going to not be necessary.
Yeah, it's a good point. So I tell people a lot of time, people are always concerned about the future of work. And, I don't want my job to be replaced by a robot. Dollar
Hmm.
General is about to roll out employeeless stores where you just self check out, and
Wow.
it's just like just going all this automated. And what I tell people is, man, medical is the one industry that's always going to be necessary. Like, you're going to have that
Yes.
physical human touch in the medical fields. Architecture and engineering, people are always going to
Hmm.
need buildings, houses, structures, to live in. So that is also an industry that, if you're looking for job security to go into, also the education industry, people will always need to be taught, because there's always learning, and there's always, whether it's college, whether it's elementary school, high school, whatever. And it doesn't just mean being a teacher. There's a lot of, like we just talked about, school nurses. Like, there's just a lot of different types of industries you can go through for that. So definitely consider an industry that requires that human touch. And the other one I always talk about is transportation. People are always going to want to
Yes.
take vacations. Pilots are also in a severe severe situation right now as well.
Hmm.
But always going to need pilots to fly if you're trying to go somewhere, all of this kind of
Yes.
thing. So definitely, nursing is an industry in the medical field that, if you're looking for job stability, you're looking for something that and you're passionate about working and caring for people,
Hmm.
definitely worthwhile considering.
Yes.
If especially if you're looking for stability, because it sounds like there's a lot you can do.
You can grow so much. There's one thing I didn't mention was informatics. Everything is becoming automated, like you mentioned. Everything is computerized now. There's nurse informatics. So you just focus on the nursing aspect of these electronic medical records. So it's just so vast.
It's a it's definitely something that I never realized the scope of coverage. Like, you think of a nurse as, really, no disrespect, the person that helps a doctor, but
Right.
it's not. Yeah, I mean,
Yes.
it's now you can go to your doctor's appointment and never see a doctor and get full
Correct.
complete
Yep.
care.
Yes. Yes, ma'am.
Yes, so you
Yes.
guys are like the vertebrae, the backbone, really, because of
Of
the different,
healthcare.
yes, because of the different degrees that you talked about, that exist, that do different things, even from the certified nurse assistants. Like, without
Yes.
them, they're just wouldn't there will be a lot of things that were basically basic needs that we need done that wouldn't even be able to get done. So,
Correct.
um, if you're a student and you're watching this and you're just not sure what career path to take, and you have patience and you like people and you like caring for others, definitely consider this field, this industry, because, as Nadia mentioned, there's a lot of different avenues that you can go. And there's a lot of opportunities that you can earn because they're looking for people to work in this field. And so, if you don't know what you want to do, explore the medical field, explore the nursing route, because, as Nadia said, she's a nurse, I'm not, but it's definitely worthwhile for her. She doesn't really have any regrets,
None.
and she's still moving up. She's already a nurse practitioner and still moving up to learning more. So we're just excited for you to share your story. But let me just ask you, so is nursing one of those careers that you can get your student loans forgiven? I'm asking for a friend.
Yes, it
Yes.
is. It is. It's a very lengthy process, but it's one of those things. You have to work for a certain type of hospital, not for profit. There's little stipulations, but yes,
So
it
you
is one of those
can.
careers.
Wow. So definitely check that out. Life as a Nurse with Nadia Hankerson. Is there anything else that you want to tell anybody watching that might be a nurse, might be interested in nursing, or might just know or love a nurse? What would you say?
Stick with it. Be true to yourself. Put the patients first. When you're at work, focus on the patients. Interact, listen to them, engage the families. Just make it a good experience. And I think you'd enjoy your day and the
Mm-hmm.
career more when you do those types of things.
It's fulfilling to you to know that you're taking care of somebody else.
Fulfilling somebody else and just
Yes.
they're at their worst. So do your best to at least make them feel good as best as possible.
Right, right, right.
Yes.
Well, listen, I appreciate you. We do have some comments. So Taiwan popped in and he said, I
Ah,
am so proud of you guys. Hi, Taiwan. Thank you for watching. Thank
hey.
you for, Taiwan, if you're still watching, I am definitely going to invite you because you're like the world traveler and you work in the hospitality industry, from what I know. So I think that would be something definitely interesting to talk about. So thank you for
Stocks. I think
joining.
he does stocks too.
Yes, he's
Yeah.
all over it. And so we have a comment also that says always cover yourself. And so as you talked about the malpractice piece of it, is it your recommendation that if you
Yes.
are in that type of industry where you have the ability to make a mistake like that, you should get the
Mhm.
malpractice insurance?
Yeah, I think all nurses need to have some type of policy of coverage to protect yourself.
Because you
Yep.
never know.
You never know.
Thank you so much for joining us tonight, Nadia. I am going to have you wait in the back while I wrap up the
Okay.
show. But again, and to every nurse watching, listening, thank you. Thank you. And I would just encourage everybody the next time you encounter a nurse or you interact with your nurse, remember what they're doing. Remember the sacrifices that they're making to make sure that you get the best patient care. So thank you for all
Yep.
you do, Nadia. And I'm going to send you to the back while I close out the show.
Okay.
All
Thanks.
right. Okay. So, listen, this was a great conversation just into the world of nursing, and just having a level of appreciation for all the people that work in the medical field. And tonight we were focusing on nurses. So, if you are a nurse, thank you. If you are, working tirelessly, I know she talked about 12 hours, but I know sometimes that's 13 and 14 hours. Thank you. I know that sometimes in these types of jobs, especially service jobs, people don't take the time to recognize what you're doing. And it's not that you need the thank you, but sometimes it feels good to be recognized for what you're doing. And so it's my hope that if you're a nurse, you felt appreciated and you felt recognized on this show, because I do not take it lightly and I do not want anybody else to take it lightly. The things that you all went through during COVID, the aftermaths of that, as we talked about with the mental health piece that's happening post COVID and pretty much still in COVID. So thank you so much. And thank you, Miss Hankerson. Yes, very informative. This was very good. And the more that I can shed light on the careers that go on the front line to save people like me, save people that we love, that we're thinking of in that moment, I definitely want to recognize that. And so nurses do it every day, 24/7. And for that, we say thank you. So I appreciate everyone for tuning in. If you haven't already done so, please subscribe to this YouTube channel. We're on youtube.com/the HR plug. Go ahead and subscribe if you like shows like this, content like this, so that you can be notified the next time that we go live, which will be next Wednesday, 8 p.m. right here on YouTube, or you can catch the replay on YouTube or anywhere that you listen to your favorite streaming podcast. So thank you again for joining. Have a wonderful night. Until next week, take care.